Hey, you guys, it's Crystal Jordan. I am back, and today I wanted to talk to you, kind of following up on the video that I made yesterday about, why I was gone for all 2019 and why I just kind of disappeared on y'all. So, one of the things that I mentioned in my video yesterday was that, I had found out that I had endometriosis, and I just kind of had like a whole freak out moment, and it just wasn't sitting good with me. So, for those of you who don't know what endometriosis is when the cells from your uterine lining and the tissue from that lining grow outside of your uterus, which is obviously not a good thing. Things that are supposed to be in your uterus should stay in your uterus only, right? So, this makes your periods extremely painful. So for me, I had been having really, really painful periods since I was about 14 years old, like freshman year of high school. And they just kept getting worse and worse and worse. And so for years, I kept going to the doctor, like, hey, this is what's going on with me. Sorry, you guys, my hair is getting on my nerves. This is what's going on with me, and I just need you to figure out why I'm in so much pain, blah blah blah. To the point where I would literally miss days of school, and even days of work. When I got older, because of my period. Even to this day, like where I work now, they know if I'm on my period, I ain't doing nothing. Like, don't expect nothing out of me. I'm down for the count. Usually, sometimes bedridden. And so, sorry, y'all. My hair is like really, really getting on my nerves. So, anyways, so with that being said, I found out that was going on. And so basically when that lining from your uterus is outside of your uterus, it can fall into many places. It can be in your ovary. It could, be on your ovaries. It could be on your fallopian tubes. It could be somewhere around randomly in your pelvis. It could even be on your intestines, right? So the issue with that is that when you have your cycle, when you have your monthly period, when the normal cells from your uterine lining shed, because that is what happens when you have a cycle. For those of you who don't understand how your cycle works, when you have your period, your uterine lining sheds, right? When those cells shed, even the ones in your uterus, the ones that are outside of your uterus where they're not supposed to be, shed as well, which is extremely painful. So that's what was causing those excruciating cramps and heavy periods. What else? Menstrual period irregularities where I'd have spotting in between periods, or extremely long periods. There have been times where I bled for 2 months straight type thing. And even can cause digestive problems in your stomach. So, went to the doctor, found that out, and my initial reaction to it was kind of mixed emotion, because for me, I had been searching for an answer for so long that it was slight relief, to know what was wrong with me, right? So part of my reaction was relief, oh, thank God somebody finally figured this crap out, because for a long time I had been told all kinds of stuff, oh, it happens, some people just have really bad periods, or I had one doctor tell me oh, your uterus is just small, all kinds of crap. And so, a lot of doctors had just kind of brushed it off and made it seem like I was being a drama queen. Oh, please, everybody has cramps, kind of suck it up type thing. Ladies, I am telling you now, if that is what's going on with your body, push for another doctor. If that's what they're telling you, and they're telling you oh, it's not that bad, you'll get over it. No, it is not normal. Do not allow anybody to tell you that you are supposed to be, basically bedridden for your entire cycle, or in extreme pain during your cycle, and that it's normal. It is not normal. It's honestly not even normal for us to cramp like that. If we're cramp, it should be so light we barely even think about it. So please, if you have a doctor who's telling you that, you'll be okay, no biggie, big whoop, get over it type thing, please find another OBGYN ASAP. And I don't care how many times you have to switch, because I switch doctors over and over and over again. Switch until you get somebody who it gives a dog on and is going to do something about it. So, that being said, I went to my doctor, and she's like, this is what it sounds like you have. technically, she told me that technically it's usually diagnosed during a surgical procedure called, I believe it's called a laparoscopy. Don't quote me on that. I have to double check. I'll let you guys know in another video. But she was like, let me just do an ultrasound, do a pelvic ultrasound, and we'll see if that's what it is. So I do this pelvic ultrasound. For those of you who have never had a pelvic ultrasound, they have this wand. So instead of doing it on top of you, it is inserted vaginally. So it's this wand, and it is inserted vaginally, and they literally just get in there and like move it around. It's not the most comfortable thing in the world. The best thing you can do is try to be as relaxed as possible. Because if you tense up, then it can be a little, painful and irritating. But I mean, they lubricate the wand and everything, but they are like literally moving this wand around inside of you and even like pressing, on the walls of your uterus and everything. So, or not your uterus, but of your vagina. So this allows them to literally see inside your body. They can see your uterus, they can see your fallopian tubes and your ovaries and all that good stuff that you can normally see on a daily basis and tell you what's going on. So when they did mine, the first thing that they noticed was that I had cysts. I had ovarian cysts. I had 2 cysts on each ovary. So little old me, who, knows medication but doesn't know the other side of medicine, was a little freaked out by that. Like, oh my gosh, I have cysts, I have tumor type thing. So she did inform me that at the time they're not cancerous, so they weren't really something she was worried about, because she said the cysts are actually pretty normal. Be careful with that word when you go to the doctor too. They mix a lot of stuff, say normal. But they're saying that they're pretty normal, and that if they weren't a certain size, it wasn't something to be concerned about, because most of them usually dissolve on their own. So, but she also saw endometrium. So endometrium are those pieces of your uterine tissue that are outside of uterus. She did notice that, and that's how she was able to tell me that I have endometriosis. So, for me, like I said, my emotions were kind of mixed because I was happy to have an answer. But I was also like slightly devastated because, you guys, I am an angel mom of 4 angel babies. So I have had not 1, not 2, not 3, but 4 miscarriages in my day. And 3 of them were back to back to back. 3 years, 3 babies. And I just could never understand like what is wrong with me, to the point where I was always afraid that I could not have children. And so getting the answer of endometriosis was soothing to a point, because it gave me, some kind of explanation for what was going on with my body. But then it also freaked me out because it made me feel like, oh my gosh, it almost confirmed like a fear of mine. Like, oh my gosh, I cannot have children. Which is not true. Women with endometriosis can have children. Sometimes it can just be a little harder. And we're going to talk about that. So I'm just going to give you guys a little bit of information about it, because forgot to mention that today is October 1st, so it is officially October. And October, although it's known for breast cancer and it's known for domestic violence, one thing that a lot of people don't know is that October is Pregnancy and Infant Loss Awareness Month. So that's one that I kind of hold really near and dear to my heart, saying that I've lost 4 children to miscarriage in my first trimesters. And it's just something that kind of gets overlooked. So I thought today was going to be a great day to talk about that. So we already talked about, like, some of the symptoms of endometriosis. So let's talk about the treatment. So I talked to my doctor and was like, okay, well, what do we do about this? She's assuring me that I can have a normal life, I can have children, blah, blah, blah. And she said, the first thing that she was going to do was put me on hormonal therapy. So they put me on birth control. Because it is believed, and they don't have a full cause for endometriosis, but one of their theories is that it is too much estrogen. Excuse me. So the hormonal therapy that they decided to give me, the birth control that they gave me, was progesterone instead of estrogen. Because when you get birth control, please pay attention to what your doctors are telling you, because if they don't tell you, just ask them, what hormone are you putting me on? Because there are multiple options. So sometimes your hormone, your birth control will be progesterone, and sometimes it could be estrogen. Sometimes it'll be a combination. So mine was strictly progesterone because they didn't want to give me any more estrogen. They felt like my body was producing too much of that, which was contributing to these cysts and this endometriosis. So, another option for treatment is to have surgery to actually remove the endometrium that are in your body, like those loose tissues that are, outside of the uterus, to remove those. So my doctor was telling me that, basically that's kind of something that they try not to do right off the bat because it could cause scarring, which could cause other problems if want to have children, and that as long as those endometrial were not blocking anything, like keeping my fallopian tubes from floating freely, like so that you don't know, your fallopian tubes branch out from your uterus and your ovaries are on each end. So your ovaries are supposed to be like free birds. They're supposed to float freely. So had the endometrium been sticking to them and making them stick and stay still, then that would have been an issue and they would have needed to remove them. But they didn't see anything keeping it from that. She was basically like, we'll do the hormonal therapy. And for her, the hormonal therapy was simply to stop pain. It's a pain management thing for me. So, I'm sorry, friend. So, with that being said, they went ahead and was just like, basically for the birth control part of it was simply just pain management. They're like, well, this is what happens when those cells shed. It causes you pain. So what we're going to do is we're going to put you on birth control, tell you not to have a period at all. Like they gave me birth control patches and she was like, just keep switching patches. Like instead of taking that patch off for a week and letting myself have a period, slap another patch on when it's time to take the patch off and just keep going and don't have a period. Well, that worked really good for like 2.5, maybe 3 months. Month 4, it hit the fan, okay? My body didn't really respond well to that type of therapy, and I started having breakthrough bleeding, which she said, was normal because my body was going to want to have a period. So she's like, just keep doing it. And so then when I started having breakthrough bleeding, it just kept going and going and going. I'm like, okay, hey, you said that this is going to get back on track. I bled like the unclean lady for like 4 months straight and was in excruciating pain. Like I was on my period every day. So until I just said, screw these patches, I ain't doing it anymore. And so it took me a while to get back to the doctor. Another doctor put me on hormonal therapy with pills. Same thing happened. Blood like the unclean lady. Had excruciating pain until I said, screw this, I ain't doing it anymore. And then I got back to my regular periods. So I'm still in a place where I feel like I'm dying when I have my period, but not the way that I was when I was on hormonal therapy. So right now we're looking into trying to find another option without having to have surgery. That's where I am right now. We already talked about, one of the causes being estrogen. Another cause that they're looking at, I told you they don't really know exactly what causes it, is that it's genetic. They noticed a correlation between people who have endometriosis and their family members having endometriosis, and realized that more women who, happen to have other women in their family, especially like their mom or grandma, stuff like that, the family that have endometriosis, usually tend to have it too. So they think there may be a genetic component to it. But it's fairly common. Between like 20 and 40% of women that deal with infertility have endometriosis. So it does have some type of correlation with, ability to have children, because it does cause an increased risk for miscarriage. And it's also can make it harder to get pregnant. So I'm going to be doing some updated videos throughout this month on pregnancy and infant loss awareness. Also going to be teaching you guys more about things like endometriosis, and also going to be talking about PCOS, which I know is unfortunately common in a lot of women, especially women of color. Same thing with endometriosis. Also another condition called adenomyosis. And adenomyosis I just learned about because I found out I have that and endometriosis together. They usually go hand in hand, so I'll be talking about that as well. If you guys have any questions, comments, advice, concerns, please post them in the comment section below. I'd love to hear from you. And I love you guys. Talk to you later.